rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hi everyone. Today I saw a patient with primary myelofibrosis who came in for reassessment. He asked, "Doctor, has my myelofibrosis become higher risk?" Rather than making assumptions, let's take a closer look. Our patient is a 68-year-old man with confirmed primary myelofibrosis. He has persistent hemoglobin below 10 grams per deciliter, not caused by treatment toxicity. He has no significant constitutional symptoms. His white blood cell count is not above 25 times 10 to the 9th per liter, and peripheral blood blasts remain below 1%. Let's assess his current risk using the DIPSS calculator in the OncoToolkit. DIPSS is a prognostic scoring system for primary myelofibrosis that can be applied during the course of the disease. It evaluates 5 clinical factors. Let's enter our patient's information. First, is the patient older than 65 years? He is 68, so we'll select yes. This contributes 1 point. Next, does he have at least one constitutional symptom, such as significant weight loss, night sweats, or unexplained fever? No. So we'll select no, adding 0 points. Next, does he have persistent hemoglobin below 10 grams per deciliter, not caused by treatment toxicity? Yes. We'll select yes. This is weighted more heavily and contributes 2 points. Next, is the white blood cell count above 25 times 10 to the 9th per liter? No. So this contributes 0 points. Finally, are peripheral blood blasts at least 1%? No. Again, this contributes 0 points. Now click Calculate Score. Here are the results. The patient's DIPSS score is 3 out of 6, placing him in the intermediate 2 risk group. In the original 2010 primary myelofibrosis cohort, this risk group had a historical median overall survival of 4.0 years. Importantly, this is a historical cohort observation, not an individualized contemporary survival estimate or a treatment or transplant recommendation. Let's look at how this result was calculated. Age over 65 contributes 1 point. The absence of constitutional symptoms contributes 0. Persistent hemoglobin below 10 contributes 2 points. The white blood cell count and peripheral blood blast criteria each contribute 0. That gives a total DIPSS score of 3, corresponding to intermediate 2 risk. For convenience, you can copy the result directly. You can also enter the patient's name and save the assessment within the platform. Previously saved assessments can be viewed from the Saved Results panel. If you'd like to learn more, scroll down to the reference data below for additional guidance and supporting evidence. The reference table shows how the total DIPSS score corresponds to the different prognostic risk groups and their historical outcomes. You can also expand the clinical workflow section for additional guidance on appropriate use and interpretation. The score provides useful prognostic context, but it should not be used alone to make individualized treatment or transplant decisions. For more oncology calculators and clinical decision support tools, explore the OncoToolkit.